What is retinol?
So retinol is a derivative of vitamin A, and it is a very common skincare ingredient that is used both in regenerative skincare, meaning anti-aging, but it's also very useful in combating hyperpigmentation and also acne.
Why should we use retinol?
So we should use retinol in order to combat the early signs of skin aging. It increases cell turnover. It binds to receptors on DNA to promote collagen production, so to make skin more firm and elastic as well. And it also inhibits the production of melanin so that you can get a lightening effect by using retinol as well. And it's great for unclogging pores and reducing sebum production. So it's great for patients that are suffering with acne as well. So there's many reasons to use retinol. We recommend starting using retinol around the age of 20 to 30, and when we're first starting to see the aging signs, the early aging signs. And you can also use it earlier if you are one of those patients that are suffering from acne.
When shouldn't we use retinol?
So we shouldn't use retinol or prescribe retinol to our patients that are pregnant or lactating because of the teratogenic effects of retinol on the fetus. So, and we also have, lacking data to support its safety in regards to lactation and breastfeeding as well. So we're very careful when recommending retinol products in lactating women as well. We should also maybe be careful if the skin barrier function is impaired in a patient. So if they have eczematous lesions or psoriasis lesions, sometimes it can be helpful actually to put a form of retinol on psoriasis. But if we see that the skin is quite sore and compromised, we might want to work on the skin barrier first before introducing a very low concentration of retinol later on.
Should the skin be dry, moisturized, or wet when applying retinol?
Yeah, so that's a very great question because I think there's a lot of different recommendations out there regarding this. We know, scientifically, we know that the absorption of retinol is better on dry skin. And also, if the skin is wet or moisturized prior to putting the retinol on, you will dilute the concentration of retinol in your cream and in your product, so to diminish the effectiveness of the retinol product in itself. What you can do if you get very irritated or you have this flakiness that sometimes happens after you use a retinol, you can use a moisturizer on top, but you should wait 20 to 30 minutes before doing so.
When should you, as an aesthetic provider, recommend starting or stopping with retinol?
So I recommend starting with retinol maybe 4 to 6 weeks prior to going into a treatment protocol for skin quality improvement. So any laser treatments or radiofrequency treatments or even microneedling treatments, it would be good to have your patient already on a retinol product. And then I recommend stopping 5 days to a week prior to the first treatment and the other treatments going forward, and then restarting the retinol when the skin barrier has healed properly again.